Hey there, my name is Ashley Long, and I picked a disorder of the integumentary function, scabies. I picked this. I had a couple patients that popped up and they weren't really sure if it was scabies or not, and they just kept them on isolation. I wanted to learn more about identification and how to help these patients, and I felt so grossed out about it, I figured I need to learn more, and I think we can all benefit from learning more about it. So first off, let's talk about the disease itself. Definition. Well, it's scabies. They're caused by these mites, which burrow into the skin. They create these small burrows, and it's intense itching. It's more common than many people think. Estimated prevalence to be 100 million worldwide. It's more common in areas like tropical regions. Here is a picture of what the mites look like microscopically. Little guys. Kind of scary to think that that's under your skin. So a big issue is not a lot of people know about it, and they're really unfamiliar, and this can delay diagnosis, and it can help spread it around. So we want to identify it, treat it, nip it in the bud. A lot of people that come through the ER are often from chronic care facilities, places like nursing home, anything that these patients are going to be in close contact. It is transmitted by person to person, so you're looking at families. Oftentimes, maybe if a bunch of people are living in the house, I think, dirty fraternity boys, or maybe at a mission, and they're sharing stuff like these. One person gets them, they all get them. I've even heard possibly in prison sometimes. The mites can live up to 2 days on sheets or clothing, And again, often transmitted hospital, nursing home, sheets is very common. They're usually associated with resource-poor settings. Generally had the stigma of the poor getting this and sharing it, just, kind of like some other disorders, and they're dirty, but that's not necessarily the case. Truly, anybody can get this. I think it's just a matter of circumstances and close contact. A lot of families get them. Children bring it home, children are playing and itching and spreading it, and they bring it home to their families. It affects all people, all ages, races, and socioeconomic statuses. Again, these mites create these lesions. They're like a reddish brown in color. Common areas, as listed there: fingers, right on your wrist, your elbow, on your armpit. Some private areas, a lot of areas that are dark, warm, places that are a little bit harder to see. And this intense itching is these mites are burrowing in your skin, and they're moving around. I've heard patients complain that they're more active at night. I couldn't really find a lot of evidence on that, but night, and that's when they get really itchy. And also, some of this itching is due to the fecal material of the mites under your skin, which is really gross to think about. It's really common, like I said before, transmission among members of the household. And this is kind of interesting. Your symptoms may not pop up often 4 weeks following contact. So that's why treat one, treat the whole house. We'll discuss that in a second. Diagnostics. Traditionally, they would take the skin scraping of the affected lesion, put it under a microscope, and look at presence of mites, or the eggs of the mites, or feces of the mites. Now, more so, they're identifying, they see somebody with a rash and itching, and maybe the whole household's getting it, and it's usually safer to give them cream, have them wash their sheets, do things like that instead of doing all these diagnostic studies. And basically, they get better, they have it. There's truly no accurate diagnosis. Usually, like it says, presumptive diagnosis based on clinical signs and history. Kind of like, where did you get it? How's your family? Is your family itching? Who did it start with? Things like that. Identifying the mite on the skin is actually very, very challenging to do. Alright, I have some pictures. The picture on the right is a presentation of scabies. As you can see, it kind of looks like poison ivy or something like that, so that's why it's common for this to be misidentified in ER when someone's coming in. On the left side, I have common areas that these scabies lesions appear. Now let's talk about therapies and treatment. First line of treatment is topical, the permethrin cream, and these things require whole body treatments. So patient takes a bath, then they put their permethrin lotion all over their skin for 12 hours. everybody in the household, people in close contact, must be treated at the same time. So mom comes in, kids got it, they're going to give them cream for the whole family. Usually one treatment of this cream is enough. There's generally poor compliance with the cream, obviously. I don't know many children that want to put this cream all over their body and want to leave it on there. There is an alternative, the oral ivermectin, but with any oral medicine and broad spectrum antiparasitic, you got to be kind of careful, side effects, medication. So usually the lotion is the way to go, the cream. Non-traditional therapies that I found, tea tree oil. A lot of people are into essential oils these days, so promising mite-killing effects. Tea tree oil is antibacterial, anti-inflammatory. A lot of the people that complain about the permethrin get like irritated skin, so hopefully the tea tree oil can help combat that and moisturize the skin. I have a picture on the right. We've got some tea tree oil. On the left, example of the permethrin, or the brand name is Elamite. Ironic, mite. Some complications that can happen with scabies. Obviously a big one, when you're scratching, just like poison ivy, you can open these lesions up and bacteria can get in. Common bacteria is listed right there. Severe form of scabies is another complication. It's called crested scabies or Norwegian scabies. This is usually going to happen to people that are immune compromised, elderly, they're debilitated for any kind, neurologically impaired. And this happens to them because they have altered immune response. They're not going to be itching as intensely as they need to be if scabies are crawling them like a healthy individual. And itching may not occur at all. They may not have that sensation. They may not be able to scratch. Well, these might start multiplying and multiplying, and sometimes the numbers can be in the millions. Here's some examples of crusted scabies or Norwegian scabies on both sides. It almost really just looks like dry skin, doesn't it? And cracked and just awful. Sad that somebody can get this bad. Some evidence-based nursing interventions. When I think of nursing interventions, I think of what can I do without having a prescription or order from a doctor that's going to help these patients, or also education. A big thing besides the cream and teaching them how to use that is these patients need to watch their clothes and towels and blankets in hot water and detergent. They need to kill these mites. You know, yes, they can treat themselves, and maybe the mites won't like to be on the lotion, but they can live 2 days on these sheets, so they need to get washed and treated. If you have things like toys that can't necessarily get washed, you can put it in a dark bag for 2 weeks and it'll kill these mites. Dark, isolated bag. Everything that comes in contact with the infected needs to be treated. And these are my reference. I appreciate you listening to me, and I bet all of y'all are sufficiently itching and scratching, but hopefully this will shed some light on scabies. Thank you.